you want to look good? Do you want to feel good?
Yes.
So do I.
I don't know.
Was I too,
that was intense.
Was that too desperate?
It was a lot.
Drew,
well, we can't redo it.
Okay.
You're in the right place today if you want to look and feel good, because today we're going to share some of the hottest procedures, products, and trends to help you feel and look your best. Starting right now with the procedure for a better chin without surgery, using just your own fat as filler. Facial plastic surgeon Dr. Kian Karimi is in the procedure room as we speak with his patient, Tina. First things first, Dr. Karimi, before you get into this, Tina, why do you want to have this procedure done on your chin?
I've always hated my profile. I hate taking pictures. I've done exercises for my face, and it just isn't helping.
And Dr. Karimi, I'm sure you will agree that whether man or woman, that lower third of the face, you need strength there. You need balance with the other 2/3 of the face to give you an attractive look.
Absolutely. So Tina is an excellent candidate for a chin augmentation, and there's a lot of ways to do a chin augmentation or a chin implant. You know, you can see here from her profile, her chin is really weak compared to the rest of her face. And so we're going to be augmenting this area here for chin. Traditionally, we were putting in silicone implants, but now there's a great option. We actually started at 6 o'clock this morning. We harvested a little bit of that stubborn belly fat that's so hard to lose for all of us, but it's good for something. So we harvested some of her belly fat, and in 5 minutes, we're gonna give her a customized chin implant.
Now, I know you're using fat, but you're also supercharging that fat, aren't you?
I am. So this is called the ALMI procedure because it's all from you, ALMI. And so we're going to be mixing the fat with her platelets concentrated. And so the two together are going to be really synergistic to allow those fat cells to survive and give her a permanent result with fillers.
And explain, this is fat that you have treated in a very special, unique way to enhance the chances of those fat cells surviving as a graft.
Absolutely. So the fat is harvested very delicately just by using our hand, and you'll see that how we did that this morning. And then we will mix it with that concentrate of platelets and then inject it just like we would with a regular filler like Restylane, for example, and really give her a customized augmentation of her chin and of this area in front of the jowl to hide the jowl. And you're going to see a beautiful result.
Is it go time?
Let's do it. So I'm going to do a little bit of lidocaine just to get her numb, a little buzzer. And we use this little buzzer to distract from the pain. So tiny little injection here. And Tina's really tough. She showed us that this morning. So just a couple little injections. We're going to be using a blunt cannula so that there really shouldn't be any bruising with the procedure, and we'll be able to come out for our immediate reveal.
And with a blunt cannula, you're less likely to injure any of the tissue there, whether it be a blood vessel, a nerve, muscle, etc.
Okay, that's the sound of our PRF ready there, and we're ready to inject. So if I could just get some prep. So, you know, preparation is very, very important, which is why we did the fat harvest at my facility this morning to really ensure a sterile environment. But the injections we can do safely here.
And you notice Dr. Karimi's markings, that it's not just creating a little bit of a button chin. He's marked that so that he wants to also create a jawline, you know, starting from that so-called pre-jowl sulcus past his chin to the opposite side.
Doing okay, Tina?
I am. I want that jawline. Ooh, sorry.
Here's the.
It'll be worth it. You'll see.
Thank you. Oh yeah. So as you said, Dr. Orden, so it's not just the chin. We call it the 5-minute chin, but in front of the chin, we call it the pre-jowl sulcus. It's a hollow that's there. And Tina had mentioned to me earlier, she had undergone menopause a little bit younger, in her late 30s. And what happens after menopause, and just with aging, is that we lose some of our bone. And so by losing this bone structure, that's why this has gone down faster than other parts of her face.
And what's the cost of this procedure?
So it ranges depending on what areas we're doing, but for a chin like this done under local anesthetic or awake, anywhere from $3,500 to $4,500.
But, you know, the good news is here that, as Dr. Karimi said, the stuff we're getting
Permanent.
is free. It's your blood and it's your fat. For that reason, should last longer.
Walk us through, Dr. Karimi, what you're doing here.
So this is a long cannula, and what I'm doing is I'm actually starting the augmentation process. You can actually see the fat coming right there. We've already seen a little bit of the chin being augmented. So these are her own fat cells mixed with platelets, and we're getting this, and I can customize this. So that's different than doing like a silicone implant, which just has a rigid shape. I can go in and see all the individual precise pockets. And I've just done 1 cc already. So if you were to do 1 cc of a filler like Restylane or Juvederm, that alone can cost you anywhere from $800 to $1,000, and that only lasts a year. And so this is a way to have fat cells, which are surrounded by stem cells, with this ALMI procedure to make a customized implant. So it's
How much total will you inject in a typical procedure?
So for her, we're gonna use probably about 10 cc's. So that's equivalent to about 10 syringes of filler.
And Tina, you look comfortable. How are you feeling?
Not bad. Just a little pinch here and there, but it's okay.
And you see his technique. It's very specialized. He's doing little pulses of injections. It's not just a squeeze of the syringe and a big bolus of fat. He's doing it incrementally. He creates tunnels, and he's injecting as he's withdrawing.
Small amounts, just like you said, Dr. Orden, because that allows the fat cells to survive. And so there's a much better chance they'll be hooked up to blood vessels for that permanent result that we're looking for.
What are the potential side effects?
So anytime we inject any type of filler into someone's face, whether it be with fat or with a synthetic filler that you can get off the shelves, there's always the chance of infection, which fortunately is very, very rare. The other thing is bruising, of course, which can happen with any procedure. Here we can already see the nice jawline and chin that we're creating. And with fat and with any fillers, we always try to avoid injecting into any blood vessels because that can lead to some, pretty problematic side effects. Fortunately, this is not a needle that we're using. This is a blunt cannula. So the tip of it is smooth, so the chance of injecting into a vessel to cause a problem using this gentle technique becomes very, very small.
And so, Dr. Karimi, we're going to let you finish and get back to you in a minute. So I assume you're going to continue to inject and mold and create that chin that we're going to see a little bit later in the show. Tina, relax, enjoy. We're going to reveal your new look later.
We'll do both sides for you.
Thank you.
Earlier in the show, facial plastic surgeon Dr. Kian Karimi started a 5-minute chin procedure on his patient, Tina. It is now time to see Tina's results. Look at these before and now after pictures.
Nice.
So, Tina, I saw a little bit of a gasp there. What do you think?
Amazing. Amazing.
I mean, I know it's a new look for you, but trust us who don't know you, and we saw you one way, now seeing you in a matter of minutes this way, it really is a remarkable, nice change.
Yeah.
Well, Dr. Karimi, very nice result.
Yeah.
Short, sweet, not bruised. And, we talked about it, an option in lieu of facial implants. I think you have more control. If you're injecting, you can customize everything that you're doing, how far you want to go on to accentuate the jawline in addition to the chin. So tell us what you did.
There's a lot of options to augment your chin. And when we look at silicone implants, they often come pre-designed, and we're kind of forced to use that design, and you have to make an incision, you have to go through a lot of recovery. With doing an injectable like filler or fat, we can customize it and sculpt someone's actual chin and jawline. And the nice thing about this ALMI procedure, it's completely 100% natural. So it was her fat cells that we got this morning at the office, mixing it with concentrated platelets, and literally in a matter of minutes, just backstage, we were able to kind of sculpt the filler into a very precise pocket, and we can see an immediate result. So it's really great.
Natural and great balance. And tell us, we're not just using it in the chin and jaw, right? I mean, when we take fat, mix it with PRF, a lot of applications.
you can do full facial rejuvenation with this. And so when someone comes to my office and they have hollows under their eyes, their cheeks, and we're starting to talk about 6, 7, 8 syringes, I start talking to them about fat transfer because it's a lot more cost effective to do that. Because if you're gonna do a bunch of syringes of filler and it's only gonna last 6 months to a year, it doesn't really make sense in terms of finances either. So it's far better to use something autologous, meaning from yourself, and something that's gonna give you a more permanent result.
Are we moving to a place, except in extreme circumstances, where the implants are no longer going to be a standard? Because to me, I'm listening to all of this thinking, why would I put an implant in my chin if I just watch Tina have this done and she doesn't have a foreign body in her chin?
Right. Not only that, but the fat cells have stem cells attached to them. So you don't just get the filling result, you get a complete improvement of the environment, of the tissues, and improvement of the skin. When we do fat transfers to people's mid-faces and under eyes, you see tightening of the skin, improvement of acne scars. It's absolutely incredible what our own bodies are capable of doing.
And it looks natural.
Mm-hmm.
I mean, the only limitation would be if somebody didn't have fat, but you know, this volume of fat, we're pretty good at finding.
People are giggling. They're like,
Well, believe it or not, there's some people that don't have a ton of fat, but in our hands, we can find enough fat that we need for something like this.
Well, this is a great result. Tina, thanks so much for sharing with us.
Thank you.
Great job.